Hey guys, thank you for sending in your questions. We picked one this week. Somebody said, can posture alignment therapy help with carpal tunnel syndrome or hand pain from typing?
Yeah, absolutely. And I think it's something that we see and everybody's on not just computers, but also mobile devices. So we've got this like flexed position and of course that can affect how how the nerve conduction is going through the wrist and through the hand and mostly is related to typing though on a computer. Hopefully you've got a good ergonomic setup where, you're thinking about, you're the angle, the 90-degree angle at your elbow and, shoulder position, being able to be relaxed versus, being on that coffee table or slumped over in your bed or on the couch or something like that. Hopefully those things are givens. We do have like an ergonomic assessment that you can take a look at. We'll put that in the description below, so you can self-assess your workstation as well and your posture going in. But yeah, it's something that we definitely see a lot.
Yeah, and one time of life that is really common to get carpal tunnel syndrome is actually during pregnancy. And you're not really typing more when you're pregnant, but your whole alignment, your whole body shape is kind of changing. And what happens is a lot of women go a little bit more anterior and then they feel heavy and they let their shoulders round forward. And then you start to compress nerves up here, but also the second that you round forward here, your elbow bends. And when your elbow bends, you start turning on the pronators, supinators, and then your wrist gets affected. And so just by having your shoulders back and down and your arms straight, a lot of that sort of nerve compression and tension can go away. So there are a few tests that you can do to see if you're more rolled forward on one side or if one elbow is more bent. And I don't know, maybe Kim, do you want to pop up and go against your wall and
Yeah.
maybe
Yeah, I
just
was like, I
talk
have
us
a
through like
perfect wall
a,
here for that. Yeah, let me
yeah.
just take off my two jackets because it's cold in California. California cold. It's 42 degrees. I'm sorry. Um, no, it's probably like 60 right now. For me, one of the easiest things to see are my arms in a good position with my shoulders is just standing up against the wall. So if I have my heels, my buttocks, my upper back against the wall, I'm going to take the clip out of my hair so it doesn't push my head forward is how far are my arms away from the wall? So you might not be able to see my feet, but if I put my heels, my buttocks, and my back against the wall, are my arms in front or are they able to lay flat? Let me actually bring it a little bit more to the side here. And not just shoulders, you can see my elbows are a little bit bent. I do have a little bit of shoulders in front. So me completely relaxed, I'm here. I can force it back without having much. I don't have any tension at all if I pull my arms back. But for some people, because of the posture of where they stand or where their muscles are pulling in front, I see a lot of clients where they're standing and it's here. And even if
Mhm.
they pull their shoulders back, then it looks like this. And if you notice, my head now is a little bit in front.
Yeah, and that's a really good point. If you do go against the wall and initially your shoulders are rolling off and you force them back, then does your head jut forward? Does your lower back sway forward? Because just forcing something into the right position is not a good fix. And now at that angle, we couldn't really see Kim's other arm. I did notice that left elbow was bent. So if she was in front of me, I'd be really curious to see if the right was bent as much or more. And then we have to kind of look and see what is the flexibility of maybe your forearm muscles. Maybe is your biceps too tight and you have to, do tricep work or lengthen it out. There's a really nice exercise that kind of opens up the forearm. It also opens up your chest and pec. Again, Kim, you're kind of in a better spot, but
Yeah.
yeah, I can show it a little bit. You would stand sideways to a wall and you want to really spread your fingers so your middle finger is facing the ceiling. You want your feet even. You don't want to be leaning one way or the other, just sort of nice and relaxed and even. You want to relax your shoulders back and down, maybe even have a little engagement in between your shoulder blades, and then you're twisting your elbow back and forth. And what you don't want to do is you don't want to have it all be moving the shoulder. Your shoulder should stay relatively still and your elbow should move. Now, depending on whether you have carpal tunnel, whether you have a super tight forearm, everybody will feel that in a different spot. Some people can't even get their hand flat if they have a super tight forearm, and you might have to do a forearm stretch. But that one little exercise, just putting your hand on a wall and kind of making it closed chain, locking that hand in place and moving your arm is it's a great test to see how mobile you are, but it's also a great stretch and release to see, ooh, do I feel it in my forearm? I don't have particularly tight forearms. I tend to feel it more around my bicep, but a lot of people that come in, especially if you have carpal tunnel or just like wrist issues, you're going to feel it in your thumb, or you're going to feel it in your fingers because you're just going to be so tight there. And so that's just one of those areas where we need to change the length tension.
And again, kind of going on with, well, what part of your body are you feeling like along that arm? Guess another test I can demonstrate, because I have this easy wall here, is a forearm stretch. And again, same like Carrie Ann said, it's a great stretch as well as a test to see where are you. I'm going to be standing next to the wall. My arms are down by my side. I'm going to try to have a 90-degree angle at my wrist and at my elbows. Just coming up to the wall, feet hip width apart, and just standing here. Am I able to get in this position, or do I feel like my hands, can they flatten? Again, without me leaning forward, arms just relax by the side. And I'll have a lot of clients tell me, oh, when I'm doing this, they say like, I feel things happening like in my whole body, not just a stretch only here in the forearms, but they'll say they feel their shoulders kind of like relax and pull back, or they'll tell me that they feel their neck release even just by getting in this position and holding it. And it gets easier as you do it over time. Of course, the first time you do it, it's just like, oh my gosh, I've never stretched my hand in that position. But as you do it, it should get easier as you do it each day.
Yeah, and very few people that we assign that exercise can do that and look like that. So if you're trying this at home and, Kim had just her hands chilling against the wall, if you have a big gap, that's okay. It'll change. It's a stretch. It's something that your body, you need to adjust to get into it. And that's why you would do that. If it were really easy for you, we wouldn't give it to you because you don't need it.
Yeah, and in both those exercises, I think they point out not just the, tension that's in the forearm, wrist, and across the elbow, but then moving up to the shoulder, moving into the thoracic spine. So those are the things you want to pay attention to also. And then, like Carrie Ann's point with the pregnancy is like it extends down to the pelvic position, and that doesn't, you don't have to be pregnant for that to happen. So we see a lot of people who are anterior pelvic tilt or stuck in their pelvis in that sort of lordotic, kyphotic posture where the upper back is rounding and stuck, and that's going to bring the shoulders forward. And then that's going to set us up where, those muscles never get to relax. And so there's always that tension. The other thing I would just add real quick is that there's a couple of tests you can do. So there's one is where you just, tap on the nerve, and then you can get a sense of, just past your wrist, sort of towards the palm. And then do you get sort of a tingling or nervy sensation into the thumb and the first couple of fingers there? And then the other one is where you stand and you bring your hands together, the backs of your hands together, and hold that there for 30 to 60 seconds. And then do you get, again, that same sort of numbness and tingling? And then what I would say is try those two exercises that you were just shown. Try the standing at the wall as a test, but then try the chest openers that Carrie Ann showed, and then try the forearm stretch that Kim showed, and then come back to those tests and get a sense of, did that change? Did that adjust the sensation? Those are quick ways to say like, hey, like if the exercise got better or changed something, and then I don't have that positive test, that maybe this is a postural problem and I should look at more than just the wrist. Because we know, we've seen lots of clients who get surgeries and go to the extreme, but if there's a way to sort of non-invasively take care of that, then why wouldn't you go there first?
I mean, yeah, the only thing, I feel like everything that I would have said has already been addressed, but I do like the idea of using everything that we just talked about as both a stretch and also a test, just because I feel like it's helpful for clients, because they can start to, again, just think about all of those different areas that they're feeling, instead of just hyperfixating on the tingling or the issue like in the wrist and hand area. Think about, again, well, are you feeling it in the shoulder? Are you feeling it in the pelvis? So all things that we already kind of touched on, but that I feel like is a big eye opener for a lot of my clients, at least, is when they start to actually feel these different areas of their body and how they all connect.
Yeah, yeah, that's a good point. And when we do look at the body holistically, and it's easy just to go segmentally, which is say like, okay, the shoulder and the upper back complex and that. And as Kim was standing with her back to the wall, I'm like, oh yeah, I mentioned the head position because the head position is going to be affected by what's going on there. But that does go down to like if the shoulder, let's say your shoulder is compensating for your hip for a dysfunctional hip problem. So this is where like if you have a problem somewhere else in your body or an ankle or a knee or something else that's just not working right, then your shoulder can actually compensate, take over for that. And now it's being sort of hijacked as a way to, create movement or to stabilize for something else. And then it's like, well, we've got to unlock that other piece in order to get to the shoulder so that then we can get the wrist to release. So there are these sort of multi-step, not just, one layer, but we've got to, peel the layers of the onion. So Miranda, I think I hear that in what you're saying, because you see a lot of the new clients that are coming in, and it's a it's trying to help them to understand like there are these layers of the onion, and so we can release these, but then tying the pieces together enough so that it's like, well, why are you working on my ankle, or why are you working on my hip when I'm talking about my wrist? Like, what does that have to do with it? Because nobody has told them that before.